Hello, everyone. My name is Dr. Shams Iqbal, an interventional radiologist at MGH and Newton Wellesley Hospital. Today, we'd like to share our insights following collaboration of these two hospitals, one being academic medical center, the other being a community hospital, and how the coverage changed the utilization of interventional radiology services. There's nothing pertinent to disclose by any of our staff. As an introduction, most of the IR practices are centered in academic medical center and large urban hospital. However, community hospitals serve majority of the rural American population and large proportion of the urban population. And community hospital, by sheer size, they cannot afford a full-time interventional radiologist, thereby affecting the quality of procedures offered and the safety of procedures. IR is rather a specialized practice, therefore, community hospitals need to have such a service and they cannot afford it. One of the potential solution for this is collaboration of the community hospital with a large academic medical center. So in our case, Newton University Hospital is the community hospital and Massachusetts General Hospital is the academic center. In 2019, we collaborated and the IR service was covered by Massachusetts General Hospital service team. Our objective for this study was to evaluate the impact of interventional radiology practice after the transition of the IR services by the academic medical center. After the transition, additional staff training was performed and orientation was performed and a support staff was provided and a significant time was provided by a single interventional radiologist who was on site for 24/7 coverage. Other changes included quality assurance program, interventional radiology clinic, multiple new programs were introduced, especially interventional oncology, including embolization and image-guided ablation, and multidisciplinary tumor board presence was increased. We queried the hospital database and reviewed the number of procedures and the timing of the procedures by modality and by service type for 6 months after the transition. The 6 months before the transition served as our baseline, and we looked for the changes in volume of the practice as depicted by percentage and proportion. This is the most significant slide for the whole presentation. The number of procedures increased almost 53% from the baseline, and the median for procedures before the transition was 5 per day, and after the transition, the median was 7. This was significant with a p-value of 0.001. Both outpatient and inpatient services showed significant increase with much more in the outpatient criteria. The greatest increase was demonstrated by the CT-guided modality, along with the other modalities also showing increment. The vascular procedure increased by almost 29%. Another significant metric includes there was improvement in the order to performance time of procedures for the inpatient and some of the ER procedures. This is a bar chart showing the number of increment over the 6-month period was almost 53%. This is the bar chart showing volume by service type, and the outpatient increase almost 67%, and the inpatient increase almost 35%. The ED almost remained same. Volume by modality, CT showed the highest increment of almost 70%, and fluoroscopy had a 47%, ultrasound has a 53% increment. Order to performance was depicted in hours in this bar chart. The outpatient did not show much difference. However, the inpatient, the pre-transition was order to performance time was 52 hours and post was almost 40 hours. This is almost approaching significance with a p-value of 0.06. The ED, there were small sample and big outliers, thus it is difficult to evaluate this data. So in conclusion, transition to a dedicated IR coverage model by Tertiary Care Academic Medical Center Group led to an immediate impact of utilization of IR services at the community hospital. And this resulted in improvement in patient care and increases in the total number of interventional procedures across the different imaging guided modalities. Thank you.